Okay. All right. So welcome to Open Source Antibiotics Series 2 update meeting on Friday, the 31st of July. The meeting will involve us going through the to-do list from last time and just updating everybody and generating a new issue and just going over some of the latest chemistry for the series. So all of the stuff that we're going to be talking about is on a GitHub issue number 22, which I will now share to make it easy. Let's see, let me just get the right window. It's that one. Okay. Hopefully that's all everyone can see that?
Yep.
All right, great. So so today we don't have Alvaro. I think he just said he couldn't make it, unfortunately. So Chris Alvaro was the chemist who did a bunch of this work at UNC. And he joined us last time to talk about the chemistry. He's now at the University of Edinburgh, but he's following the project, which is great, and knows about where samples are and things like that, so it's great. You are DRC 007. All right, and we'll see if Mandrake shows up. I'll do that for a minute. Okay, so lab books and stuff are now linked, so I'm going to just get rid of that completely because that's all done. And this thing about the samples at UNC already, again, that's just complete, and we need to make sure that the samples at UNC are forwarded to Monash, which is on me still. Okay. So the mechanism of action work. Yeah, we had a little email correspondence with Lee Grace at UNC, who is going to be doing the mechanism of action experiments, and he was asking about the base cell type, and I wrote to say I didn't quite understand what he meant, and to say that basically the cell that we're interested in is MRSA, and so I think he's taken that as being that's fine. So I think that we're good to go there. I just need to know Chase that he's happy to do the experiments. But that is ultimately that's where we're trying to see what the impact is of adding these compounds. So I guess that's a simple case of just starting the experiment. Let's do this.
I guess we should see if they need more of that compound to be made for those experiments, or if they are fine with the amount that they have at UNC.
Sure. Yeah. Fine. Yeah. Good. Gonna ask Kara about that. I think she knows about the stocks they've got. And the Monash measurement of the in vitro parameters. Yeah, there's no change here, so they have forwarded everything they need, and we just have to make sure that. So this is on me again. I've just got to forward that to the UNC team and say, this is what the requirements are, please ship. They were very particular about that. I think it's quite difficult to get compounds in to Monash unless they're labeled properly. That was what it was. On the tox and MRSA screening, so yeah, I had a word with Mark Blaskovich about COAD, and they are happy to take the compounds in. But I think that their primary grant has run out, which just means that the screening is not quite as rapid as it used to be back in the day. I was noticing actually that these compounds originally were screened at COAD. I'd forgotten that point. So it would be nice to continue that. We do have the opportunity of getting the screening done here by two of my colleagues who are happy to do it. Because of the lockdown and because it's now August, things are a little slower than maybe we were hoping for, I think. So I guess these two things are still possibilities. Shipping to COAD, although the grant's finished, or doing things locally, which is obviously quite attractive. I don't know of any other places that would do these two assays together on a regular basis as like a service, MRSA and generic toxicology. I just don't know. So again, if anyone's got any suggestions, all ears. Otherwise, I think we should proceed with one of these or the others.
What do you mean by tox screening?
Well, a mammalian cell, I guess, just to make sure we have a...
This is just cell tox?
Yeah. Yeah.
Okay, I'll ask around.
I mean, it's just a sort of, basic idea of therapeutic window and that we're doing something specific to MRSA. just to make sure it's fine. I guess we are doing something because, of course, these compounds were not effective against other bacteria. I'm assuming it's something specific and useful, but we should just keep an eye on it. Okay, and like I said, the reason why I'm just keen to try and do a kind of reasonably rapid turnaround so that we can synthesize and evaluate on a reasonably tight cycle rather than making 50 compounds and finding them all inactive. You know? All right, so that brings to a synthetic chemistry. I will stop share if somebody would like to share the slide. Great.
You wanna go?
Yep. You want to talk us through it?
Yeah. Do you want me to go first?
Yeah, you can go.
Okay. So I was trying to make the boronate ester of this brominated core, the EGT467. I ran that reaction overnight. I got some conversion to product, but mostly starting material. So then I just ran the borylation on the other coupling partner, and that on my test reaction worked fine. And I was able to purify it and then run the Suzuki. So I just need to purify that, but I think the reactions work. So I also set up 3 other borylations of our other building blocks. And then those will be coupled to the core as well. And then that's our final product. So yep, that's what I've been up to this week, and probably a bit of what I'll be up to next week also.
Okay, sorry, just one sec. Wait, I'm just trying to. Okay, right. So you're just trying to buckways round, right?
Yeah,
so
it's the same conditions, which is why there's only one arrow, but
right,
obviously on either end of the coupling.
right. And the next ones are the ones listed underneath the boronate.
Yeah, so I've done the borylations, have to purify those, and then do the Suzukis.
Got it. Great, great. And these are novels?
So the first one, the 120 building block going to the 124 product, is a resynthesis. The rest of them are novel.
Great, okay. And subtle changes, but okay, great. Yeah, looks good. And how was the chemistry?
Fine.
No, I mean right, okay. Great.
Yeah, the purification of the borylation that I've already purified was nice. And then I think the Suzuki's proceeded pretty cleanly, and all the TLCs, they don't look bad at all. So looks pretty good.
Great. Okay. And when you get these guys, you're installing in the spreadsheet with the OSA numbers?
Mm-hmm.
Okay. All right.
Yeah, I will usually just do them all at the end, kind of in a batch.
Fine.
I will do that.
Okay, cool.
And then, yeah, so for my stuff, we had 2 boronic acids already. So I did Suzuki's on those, and I've made those 2 final compounds. So those are ready. And then we have 2 more bromides left, which I'll convert to the boronic esters and do the same thing that Dana did next week. Yeah.
Great. All right. That's fantastic. Okay. One comment came up on the call that we just had, which I'll mention in a minute, about solubility. I guess there's no problems with these guys being soluble in organic solvents, right? But we don't yet know anything about their solubility in aqueous.
No. I've been using methanol DCM to purify them, so yeah. I mean, they don't seem particularly greasy to me, but I don't know how soluble they are in water.
Okay.
Have you tried making salts of them?
No.
I mean, you've got a pyridine there, but it's got orthoheterocycle as well, so that may well help coordinate protonation. Could be able to make salts, help solubility.
Yeah. Also, it'd be nice yeah, to keep an eye on their general ability to withstand lab temperatures like today, you know, without going off. So just keeping an eye on how stable they are would be good. But yeah, quite right. All right, great. Just remind me, because I should know this. Besides this variant, what's the next variant that we're thinking about? Is it on the imidazole 5-membered ring? Just remind me what the kind of next big chunk of stuff we were thinking about doing.
Yeah, so not too much. I was looking at making basically the unsubstituted imidazole, or just the diaryl substituted, right?
Right.
And then, so I found literature procedure where it's essentially you can just do a Suzuki between the pyridine and the core, and then brominate and do another Suzuki. So it seems pretty, you know, not too complicated to make. And then, yeah, we'll have to do a little bit more planning, I think, on what to make next beyond that. So I was thinking I could make the NH and maybe the N-methyl, you know, by that procedure.
Mm-hmm. Yeah, if memory serves, the prediction of clearance here was on the thiophene as it was, which of course you've gotten rid of there in the bottom compound, on the other compounds you're making. And also on the unsaturated 5-membered ring that's fused to the imidazole, right?
Yeah, yeah.
I guess that's the sort of second in line of things we want to get rid of.
Yeah.
Cool. All right, wonderful. Great stuff, thanks. And then, so that's really good, thank you. If you just, after the meeting, just drag that file to here somewhere, so we have it kicking around. Compound numbering thing, I'll get rid of this eventually, because we dealt with that last time. And then, so yeah, on number 8, we have had interest from Pfizer in doing the metabolic work, which is great. And so the default plan is to send some compounds when we have them for that kind of biofunctionalization work, to try and isolate the metabolites and see if they're active. And Scott has very kindly put me in touch with a UK company, Haifa, who have, I believe, because I scanned my inbox listening this morning, sent me a follow-up. So leave that with me, and I'll see what I can report back about whether we could do any work together. Just got to read some emails and check there's nothing confidential there, which is good, because that would be interesting to see. I mean, it was actually quite interesting looking at the SAR just now on our previous call, and thinking about some of the more active compounds are the ones with the more obvious metabolic liability. And so it does naturally make you think that perhaps it's something to do with the metabolite that's active. It's certainly something that's worth investigating further. We, just to bring up the speed here, Chris, on point 9 here, we were wondering about whether there was anything as a kind of very rough and ready in vitro sort of chemistry lab assay for if a compound was liable to be subject to in vitro metabolic clearance or oxidation. I know there was a paper a while back about a mimic of aldehyde oxidase type activity, and we were just trying to find out whether there's this sort of a little bit of a kind of standard way of seeing whether compounds are likely to be cleared well by doing a sort of chemistry lab test, sort of TLC-based conversion assay, but we couldn't really find anything that was a standard here. I don't know if you've ever seen anything like that, or if you have any advice.
No, I have not, I'm afraid. I mean, I think the in silico experiments are probably as reliable.
Well, quicker.
Yeah. Well, you can do them without compounds as well. Yeah.
Okay, fine. We can get rid of this. It's really, I think if we're happy with the in silico predictions, and we start making compounds, we can just send it to monitor. We can go from there. That's fine. All right. Number 10 was the call that we just had. So I can't really say anything yet because I haven't got it clear. But we just had a very good conversation with James Callahan at GSK, who was the corresponding author on the original article which reported these compounds. So we just chatted to him about the origins of this series and what they found out about the series. And I'll write out some things to clear with him about what we can reveal publicly. The aim, of course, of their work was not MRSA. The aim of their work was ALK5, so that sort of kinase inhibition work. So, it's not as if they're necessarily sitting on a treasure trove of information about antibacterial activity, but obviously we're trying to ask for whether they have any compounds that are structurally related to what we have, firstly, and secondly, they might be able to share, and secondly, whether they solved any of the issues to do with perhaps fast clearance or low aqueous solubility, if that's a problem, those things. And so he's going to do a bit of rooting around and putting us in contact with some other people there to make sure that we can extract what they've learned from this series as it went on. Like I said, it's mostly relevant, I think, to the early stages of their project before they started to optimize for the indication that they wanted, for the target that they wanted. But we'll see. So I'll try and get something to share with everybody after I've got it cleared by James. But that's promising. And then there's just other recurring things about design criteria. So yes, keep an eye on LOP and clearance, and try and promote these issues and these meetings and anything else via the usual channels to bring people in if they're interested. Ideally, pictures of molecules, stuff like that.
The Smart Sips one, where predicted metabolism, but there's also one called FAME by Johannes Kirschmeier, I think it is.
What's the spelling, sorry?
Well, the software is called FAME, FAME, Fast Atomic Metabolizer or something like this.
Right. Right.
It's not, I think it's only freely available to sort of academic, non-profit type things. But I would thought you would qualify, so it might be worth. I can put the link on there, and you can contact them.
Okay, thank you. Great. All right, all good. Was there anything else we have forgotten? I think we're all good. We're in good shape, right? I mean, that's everything. I found a very useful thing in GitHub. That little list of action item things. That is awesome. If you put that in there, it comes up when you actually do it with a little box that you can click to say you've done something. How sweet is that?
All you need now is some software to do it.
Yeah, that's where the difficulty comes, actually doing stuff rather than making a list. Okay.
Sorry, but I've been sort of distracted on other things. Where did you get to with doing a target product profile?
Yeah, Dana did a bunch of work on this, and yeah, do you want to talk about it?
Sure. It was kind of a while ago, so not sure if I remember. I think where we ended up was there doesn't seem to be a MRSA specific TPP that we could maybe lift from GARD-P or things like that. So I forget. I think essentially sort of the one that I basically made up is what we have right now, which is we've got acceptable and ideal, and then I think we'll just sort of focus on that.
Yeah.
What was the issue number? Do you remember?
It's kind of one of the earlier ones, maybe like 8 or 9. No, not 8. 10?
There it is. Oh,
no, sorry, it's 11. It's 11.
Right.
Yeah.
And you went to a webinar from DNDI. Am I remembering that right?
Yeah, we both did, didn't we? Yeah.
Yeah.
And I did actually ask about single target pathogen and whether people would find that attractive. And I think my impression was that the scientists thought it was an appropriate approach, because you don't really want to be carpet bombing the entire bacterial biome. But the clinicians' view was that in the clinic, when your patient presents, it can take 4 or 5 days to identify the pathogen involved. And so they want a broad spectrum compound.
Right. I mean, yeah. I think that we previously spoken about this, haven't we, about the idea that a new effective selective MRSA, anti-MRSA compound would be useful for last resort acute infection type situations? I mean, I guess that's what you're saying, Chris.
Yeah.
Yeah. Which is fine, but I guess less easy to get investment for.
Yes, and harder to do the clinical trials.
Yeah. Really?
Well, the thing is that normally in antibiotics, they like to do a clinical trial with something like urinary tract infection, because your patients, whilst uncomfortable, rarely die. Whereas if you're going the sort of indication you're talking about, there's likely to be a very high death rate.
Right. Good point. Yeah.
But that's not to say there isn't a clinical need. It's just more of a challenge.
Yeah. I mean, to my mind, I'm actually quite interested in the idea that they are only active against MRSA. It's quite,
Yeah.
Because you think, well, that makes something extremely specific.
Well, have they been tested against any other gram-positive? Because I think COAD's panel, most of the other ones are gram-negative. So that could potentially explain why.
Huh. We need to dig out the original data then, right? Which we can get from COAD. Do we have that?
I think on their website they have, which I'm pretty sure we have that.
Just to check the results that we got back from them before the project started.
Yeah.
That's an interesting point, though. Yeah. Maybe when I've saved this, you could maybe update that comment with something about that. That's a really good point.
Sure. Yeah.
Okay. Fantastic. Anything else? I mean, I'm away for a couple of weeks, so I guess we can pause these meetings, or you can just have them, or we can just keep on updating this and try and make progress here. I'm easy, whichever way. Okay, great. Thank you very much for coming along, guys, and thanks for coming along, Chris.
Pleasure. So is the plan to have it at this time every week?
Yes, I was trying to get it in the diaries, and
yeah, I'll put it in my diary, and if I can, I'll try and come along.
Great. Yeah, that'd be really good. I mean, some weeks it'll be 5 minutes, some weeks it's longer.
Yeah.
So
I think having a recurring date is really good idea.
Yeah. All right. So again, I'll try, and now that I know what I'm doing, I'll try and post the recording quickly and just make sure it's up there. Again, just to try and make sure that I'm always tagging it with Open Source Antibiotics to make sure they're easy to find. It means that other people can post things to YouTube if they want to, and have it all linked.
Yeah.
All right. Wonderful. Thanks for coming along. See you all again soon.
Okay. Thanks. Bye.
Bye.